On this episode of the Theo Therapist Podcast,
your voice matters, your experience matters. It needs to be heard. You deserve, healing. You are worthy. So my mind went to that, which you highlighting those experiences and how the narratives, the stories of individuals need to be heard.
Welcome to the Theo Therapist Podcast, where theologically trained licensed therapists share health and healing conversations. Join our host, Dr. Trice Glenn, for conversations about real-life issues from both theological and therapeutic perspectives.
hello and welcome to Season 3, Episode 7 of the Theo Therapist Podcast. My name is Dr. Trice Glenn, and I am so thankful that you're joining us today. This has been a great season so far. We've just had guests after guests after guests, and this episode is no different. We are definitely escalating our caliber in Season 3, and so I'm so glad that you've joined us. Please like, subscribe, and share our podcast with others so that other people can hear this great information that we've been bringing forth. You can also visit us on the website at thetheotherapist.com or seeksolacenow.com. Just a bit of a disclaimer, these podcast episodes are not intended to replace therapy. They are a supplement. They're just information that will help you, kind of guide you toward, hopefully, your professional relationship with a therapist that will help you navigate what your personal journey looks like. So today's title is one that we often encounter in the therapeutic space, and it's one that often comes up because it happens so frequently in our communities. And so the title of today's episode is Who Hurt You? The Impact of Interpersonal Violence. Oftentimes when people come into therapeutic spaces, they're trying to process hurt that has happened in their life, whether it's been physical pain, emotional pain, psychological pain. And today we're going to talk about what that kind of looks like in a little bit more detail. So I would also add to the disclaimer, if there are parts of this podcast that feel overwhelming for you, I encourage you to just pause it. Take care of yourself, reach out to a source. We'll provide some resources to you, I'm sure, throughout the podcast, but make sure that you're taking care of yourself. Our awesome guest that we have today is none other than Dr. Kamilah Jones. She is a licensed clinical social worker. She also has an MDiv from Candler School of Theology, where I also serve and work. And so I am so happy to have her here. Thank you for coming today.
Wow, thank you.
Looking at the very, very long CV and resume that she brings forward, it's easy to see that she's a highly sought after mental health professional. She has over 20 years of experience working in behavioral health. She has her own private practice called Insightful Wellness and Empowerment Services. And she recently launched Ignite Transformation Institute for the Wellness of Women. It's a nonprofit that she's starting that's dedicated to empowering survivors of sexual violence and addressing the unique challenges faced by women while providing them hope, support, and resources. I'm so glad that she's here. She uses all of her free time and her efforts to give back to survivors and find ways to help them with support and their healing journeys. And so I just thought she was a perfect person to come in today and talk to us about how do we help those who are working through this field of hurt, this pain, this past of hurt. And so welcome, Dr. Jones. I'm so glad that you're here today.
Oh, thank you so much for this great welcome and introduction. And first, I just want to say thank you for inviting me to join this important conversation today. I'm truly grateful to be in this conversation with you and to explore this topic because, as you stated, it is a very important topic. And in my experience, I feel that it's not being talked about enough. I also want to say that I thank you for being a powerful model and example for showing how we could bivocationally work and practice at the intersection of theology and mental health. And that is also deeply needed. So thank you for leading in that. And I also want to echo what you stated, that what we're talking about today is a very painful topic, yet it's an essential topic. We need to start having more crucial conversations around this and giving voice to it, because this form of violence tends to happen in a culture of secrecy. So just giving voice to it, I think, increases freedom. It helps healing. It promotes prevention. And it increases awareness. So similar to what you stated, those that are listening or watching, it's just my hope that all listeners and viewers take care of themselves as well.
Mm-hmm.
And sit in the conversation, but also pull back if that's what they need.
Absolutely. First and
Yes,
foremost, we want people to take care of themselves.
absolutely.
One of the things that I typically start the podcast with is because people don't often understand, those of us who sit in this bivocational intersection of
Mm.
theology and therapy, kind of how we got here. And everyone's
Oh.
story is different. Everyone's story is unique. I'm curious, how did you get here? How did you connect these dots?
Oh, it's been such an interesting journey. I was born and raised in the church, did everything you could think of in the church. And I want to start with saying, as it relates to my calling, I was like, oh no. When the calling came, I was like, you have the wrong one. I prefer to work behind the curtain. I think I'm doing a great job with that, God, because at that point, I've always wanted to just stand in the gap and be an assistance to people. And one door open to the next to work in the mental health field. And without saying that out loud, I knew within my spirit that was an extension of helping people, being a hand of God's in the world, God giving me the strength to work in the area of violence for years. But that calling was there and I resisted it. But also knew it was my faith. It was my practice of spirituality, my spiritual community, and acting on a faith that continued to help one door open to the next in clinical practice, and even help me build my strength with working in the area. So to give a quick example before I go back to the calling and how I got here. My first year in my master's social work program, I was placed at the Fulton County Juvenile Court, and I had the opportunity to work with child advocate attorneys, and I was excited about that. Always had a love for working with children. Anyone that knows me knows I love children, but that was a different experience. Here we go with that painful, suffering, challenging experience. And it was my first time being immersed in work supporting children in that way. And I questioned myself first semester. I was like, Lord, I don't know if I could do this. I don't know if I could do this, but praying like, if you support me, I know that you're telling me to go forward. And I was able to go forward. And just reflecting back on that, I look at the power of God just working, like it's living in this world. And then one door opening to the next. I would say that on the outside, let's say with my CV, people may look at it like, of course she's able to do this work and she's done this level of research and worked in these settings, because look at the clinical training she did at these various institutions. And yes, I gained tools and learned about different theories and different ways to implement therapeutic support. But again, I feel on a personal level, it was my spiritual practice that was also helping me to be in those spaces.
Absolutely.
And thank you. Yeah. So getting closer to this calling and how this continued to intersect, and which led to me surrendering. I shifted at one point to work with adults, and that was recommended in my PhD program because of the theoretical orientation we were working with, which is psychodynamic. So the thought was, okay, you need to work with adults that are verbal and they're able to express where their source of pain and suffering is coming from. It doesn't mean that psychodynamic theory can't be used with children. So I shifted to work with adults, which I learned, oh, wow, I enjoy working with adults as well. And again, the door's opening to the next. It's not like I planned it in my mind, but I went from being able to provide services to children that experience all forms of maltreatment to providing psychotherapy services to children that specifically experience sexual abuse, to then being in this adult population where I'm now seeing adult persons that possibly experience child maltreatment in their childhood years, unfortunate experiences that were taking place in their adult years as it related to various forms of interpersonal violence, intimate partner violence, domestic violence, or even self-directed violence. And so I had several roles that took on that work as being an intimate partner violence coordinator at one point, then a suicide prevention coordinator. And here we go with how God speaks in different ways. I worked on site in a hospital setting through the majority of the pandemic. And I, like anyone else, I'm human, but very empathetic to my coworkers and colleagues that were working at that time. It was very stressful. There was a lot of chaos. Nobody knew exactly what was going on, but we knew that we had to be on site every day to work. So I would get feedback from colleagues like, oh, Dr. Jones, you come into work every day with such a smile and you're happy. And I'm thinking like, wow, I didn't realize that's what I looked like, but two, that I was having that impact. But in my mind, I felt like I couldn't express what they were seeing, which I felt you're only seeing a reflection of God because I'm feeling anxiety like anyone else. In the morning, I'm getting up, practicing my spiritual practices, physically moving and walking, doing what I need to do to get in this setting. So I started to notice that from colleagues, and I felt chained in my spirituality, like I couldn't speak about what was grounding me. I started to also notice it with clients. And again, at that point, I was working with persons that were experiencing self-directed violence. And with sitting with those individuals who survived those experiences, I had several persons that would ask me, Dr. Jones, do you think I'm going to hell because I tried taking my life? And it just felt like such an important, sacred, spiritual moment, but I felt I was chained to the system I was working in. This is a hospital setting, medical model. We practice evidence-based practices and providing psychotherapy. This is my role. And navigating those questions and starting to feel an ethical dilemma, deeply think about things spiritually. So I bargained with God. I was like, okay, Lord, I will at least apply to seminary. And if by chance I get in, I know you're telling me to go. And I thought
I know how this goes.
I know. Oh my goodness.
Spoiler alert.
I'm still, oh wow. I thought, well, I don't think there's a chance I'll get in. I have a mental health background. I don't have a degree in theology or religion. I only have my personal practice of going to church, but applied. And I then got into every school I applied to. And it was like a gong went off. Like, whoa, now it's time for me to respond. Respond meaning I had this conversation with God. And I said to God, if the door opens, I will step on faith and go. So there's more to say, but that first semester, even the first semester, I realized, wow, Lord, I see why you are calling me to be here. So that's the story of answering my call. I definitely got deeper as it relates to my experiences in seminary and realizing just like developing and reconstructing my own sense of spirituality. A lot of seminary affirmed my thoughts, which I was thankful for, but it also stretched me. There's more to say about that in the future, but that's my calling story. That's how I arrived in seminary, and the doors continue to open from there.
And I think so much of this journey has to do with what you said. When you get to that point of surrender, where you decided to stop fighting, what your life can look like
My
if
goodness.
this world is integrated, right?
Yes.
I think for those of you who may not be mental health professionals, when you are studying mental health, you are pointed in a direction. You are
Yes, you
given
are.
the evidence-based medical model, A plus B equals C. But that is not how God works. That's not
No.
how God works in people's lives. That's not how God works over time.
Yes.
God likes a good monkey wrench every now and then. And so
I'm learning.
what we, I think, who do this intersection work have to recognize and hold and contend with is that everything is not black and white for those of us who live in this space. We
No.
look for God in the gray because God is present in the gray, and we look for
My
God's
goodness.
direction. And
God is in the gray.
that's the hard part, because so many people
Yes.
like to know exactly, give me the answer. Well, God
Yes.
exists in that answer, and God
Mm-hmm.
can make it what you don't think it should be. So, we'll
Yes.
put a pin in that, but that's just a nugget. Know that God can live in that gray when you're trying to
Mm-hmm.
make your world
That
so
is
black
a
and white.
significant nugget.
So, I'm curious, with your passion area and your passion topic, kind of what drew you to that?
So I really do feel I can't take credit for it. Looking back on it, I felt it was just one opportunity open to the next or opening to the next. But now I have thoughts like God knew all along that this door is going to open to the next. So I feel with each experience, God was preparing me without
Hmm.
even realizing. That goes back to my first semester in my master's program. I didn't choose to be placed at the Fulton County Juvenile Courts. I didn't choose my second year to work for an outpatient clinic that was specifically offering services to children that experienced sexual abuse and providing psychotherapy to them. What I did choose and didn't know it was going to happen, meaning after completing my master's, I took on a clinical training fellowship, and that further immersed me in the world of working with children and children that experience several forms of violence. And parallel to that, we had training in play therapy, family therapy, psychology, cultural competence and awareness. So all these things that parallel working with this population. And so again, in my mind, I'm thinking one opportunity is just opening to the next. Had to do 2 more years of clinical training when I entered my PhD program. And that's when I made the shift to working with adults. And my first year was at Smith College, where I did complete my PhD, working in their college counseling center. And
Hmm.
then I thought it was a coincidence that I made it back down to Georgia, where my second year of clinical training was taking place at their student counseling center. So in my mind, I was thinking, well, I'm aware of what the next step is going to be, meaning after the years of clinical training, our oral and written comps, we have the opportunity to then transition into the research phase. So me being who I am, I was like, well, let me look into the Emory system and who's doing research and who's open to me being a research intern. And a research opportunity presented itself. I just thought it was by a blessing. Like, oh, wow, this is great. So I could stay here and, I'm not too immersed or at that time immersed or aware of domestic violence or intimate partner violence, or even at that point, reality, which
Hmm.
now some refer to as self-directed violence. But that was the area of focus for that research program. I was just open, always been open to learning. So I stepped in that from a research angle. And that's where I was able to get data for my dissertation as well. So again,
Okay.
I have looked at it like one door has opened to the next, and I just being willing to look into the system or just look for opportunities. But looking back on it, I could say that there's been a theme and there's been a spiritual growth within it, along with a clinical experience and expertise. And I lightly say expertise. I never walk around saying I'm an expert because I think there's a lifelong journey that comes with everything. As
Well,
we
I
know, as
think we're all
practitioners.
experts of our own stories, so I think there's a room for using
Ah,
expertise. So
you
no
know
one
what?
else
I
can do
receive
Dr.
that.
Jones the way Dr. Jones does it. So,
I received that. That slows me down for a second. But the lifelong journey does continue as society advances, as certain experiences continue. We continue to work to see how we could be most effective through prevention efforts. And this has to happen on so many different levels. So we know that after someone experiences such an experience of interpersonal violence, psychotherapy comes to mind, But that happens after the onset of such an experience. But working, I don't want to say backwards, research, advocacy, education still needs to take place so that primary and secondary level work is happening, meaning education, increasing awareness, and starting that even during childhood years. Children need to know about consent. body safety, healthy relationships. And that's at the elementary age, middle school age, high school age, and even college and adult years. Like there are adults as well that need to learn how to interact with each other. And we know this because there's dating violence, again, domestic violence and intimate partner violence. So I feel again that it was one door that segued or opened to the next as it relates to the specific area of work that I've been blessed to work in. And I say that because when someone has experienced something so traumatic, now I'm using spiritual talk and also clinical talk. It is a sacred dynamic to witness and hear the details of what has occurred, hold that with an individual, and walk alongside them in their healing process while also ensuring that they feel the greatest amount of safety possible as they rebuild trust. So it's been an honor as I go forward. So yeah, those are some thoughts that come to mind when you ask, how did I end up in this area of work?
And that lends itself to the guiding question that we have for this particular podcast.
Mhm.
Each podcast, we kind of ask an overarching question from the viewpoint of the person who's listening. And the question for today is, how do survivors of intimate partner violence or interpersonal violence, how do they
Mm,
move forward toward healing?
mm.
Because after that's happened,
Yes.
you have survived whatever the maltreatment was, whatever the violence was. What
Hmm.
does healing look like, and how do we start to lean in that direction?
Yeah.
And maybe we need to describe intimate partner violence in more detail or give some background to it. But I'm
Mhm.
curious, when you start to think about that healing journey, what comes up for you?
Well, starting with the healing journey, and we could definitely go back to speak to the different forms of violence. The first thing that comes to mind again is building an atmosphere of trust. Someone experiences violence, their whole worldview shifts, their
Mhm.
core values shift, their sense of safety with others shifts. There are thoughts that go along with this, like, how did this happen to me? This shouldn't have happened to me. It's my fault. There's a lot of self blame and negative thoughts that go along with such an experience, not even if. And that's speaking from someone that was victimized or survived. I think it's an interesting dynamic to highlight that someone that survived or was victimized, that is the thought at times, blaming themselves for the experience. Well, if I didn't do A, B, or C, this would not have happened. I should have done A, B, or C, and this would not have occurred. So I think the healing process, for one, is reestablishing trust and safety. It's not necessarily rewriting history, but reframing a lot of things.
Mm.
Um, and I would say empowering individuals to a sense of hope and renewal, while also coming from a strengths-based perspective. Prior to this occurring, there were certain things that helped an individual feel their strongest, their most centered, their most grounded. And let's say if it was their faith, their spiritual practice or religion, that could be a complex dynamic, meaning for one person, that could still be a space of strength and guidance and direction. But we also had to acknowledge that sometimes the worldview shifts and there could be anger. There could be a letdown towards their spiritual practice or their God or higher power that they rely on. So being coming from a strengths-based perspective, I think is important. I think depending on who was listening, let's say if it's clinical practitioners, they get into theoretical practices and space practices like centering on EMDR, which is known to help trauma survivors, or just being trauma informed, sensitive to the nature of trauma, how it impacts an individual, the cultural aspects that may play into someone's healing process. A quick little step to the right. Being trauma informed also includes the provider, meaning there's secondary trauma or vicarious traumatization that could take place for the provider as well. So being mindful that in this trauma informed frame, there is the client that needs a certain level of clinical support, evidence-based intervention, a safe holding environment, but also for the individual that is providing that and listening to different experiences of this form of violence and providing that safety space of safety. One more intervention or evidence-based practice I'll mention is cognitive behavioral therapy. This goes back to the negative thoughts, the negative self-talk that could occur after such an experience and being able to tease that apart. Where did that thought come from? Do we know that to be true? Like just going back and forth related to the thought to get to what is the truth within that? Where does that come from? And ruling it out. I would say the healing process, in short, is a journey. I've had direct conversations with clients like it is a journey. It takes commitment. It ends up being pretty cyclical at times. You'll find that, hey, it seems like there's a sense of doing well, then, oh, wow, I'm triggered, or there's something that takes place where it could feel like a setback or a relapse. But recognizing that's a part of the process, there's going to be an ongoing circuitous experience. And the goal of psychotherapy is to assist an individual to better manage those triggering experiences so they're not as intense. You kind of shift to more being aware, like, I'm having that moment or feeling right now. Let me apply the tools I learned from CBT or EMDR or trauma-informed care or, the last discussion I had with my therapist. And I'll add also that sometimes it's going to take psychotropic medication management in addition to therapy for healing to take place. It'll be great to kind of hone in a little bit more about the spiritual aspect because I'm not being harsh with saying this, but I do believe that the spiritual community could be doing so much more to support individuals through their healing journey.
Absolutely. One of the things that I talk to people about often when we bring forth stories about maltreatment or violence
Yes.
that they've had put upon them, I say it
Mm.
that way. I do think the most empowering and the most courageous thing is to be able to tell the story.
Tell the
All of the
story.
healing journey starts with the story. You being able to own your story and say what has
Yes.
happened to you,
Mm.
not
Right.
from you, not by you, but to you, I think
Right.
is the beginning of you taking some power, the beginning of you
Mm.
owning that you have power in
Yes.
naming that this thing happened to
Hmm.
you.
Exactly.
Because so often that negative self-talk that Dr. Jones is talking about is the self-statements that we tell ourselves, the kind of things she
Hmm.
said, if I hadn't, or I shouldn't have, or
Hmm.
I was stupid for, or, all
Yes.
these negative attacks that we say to ourselves.
Hmm.
But those aren't where the trauma came from. Those aren't where the abuse and the violence came from. It came from
Yes.
another person attacking you.
Absolutely.
And
Right.
so it's owning that this might have been your story, but it wasn't your initiation.
Powerful. Very powerful statement. And to pick up on what you were just stating, there's a lot of shame internalized. So I think that kind of highlights what you're just saying, that shame does not belong to the victim or the survivor. That
Correct.
shame is actually the perpetrators. So it's just an interesting dynamic. And like you stated, the power of being able to reclaim yourself, your voice, and speak to your story, that is just a sign of strength. And I think some people feel that a sign of strength means you're speaking boldly and doing certain things, even if your voice quivers, even if it's through writing. Being able to speak the truth, your truth, that is transformative, especially when these experiences again happen in a culture of secrecy. And when we add culture, there are thoughts that this is a very shaming experience, it's stigmatizing. So then that leads to a lot of individuals not reporting their experiences because they feel they won't be believed. There are some communities that are fearful of engaging legal um, our legal system, the system that's supposed to protect us in terms of police enforcement. And sometimes there's a lack of knowledge on those sides as well in terms of what is going on exactly. Economics plays in this as well. Not everyone has the money to access legal services or quality legal services. Some don't have the money to access quality mental health services. So those are things that could stop someone from using their voice and sinking into, I don't want to say secrecy, but it's also kind of just giving up on yourself. But if these experiences touch anyone or resonate, it's like in this moment, I want to just offer empowerment. Your voice matters, your experience matters. It needs to be heard. You deserve, healing. You are worthy. So my mind went to that, which you highlighting those experiences and how the narratives, the stories of individuals need to be heard.
And I also point to, you mentioned there's some spaces or sometimes there are factors that hinder
Mm,
us being
yes,
able to navigate that easily, coming out
right.
easily. But I try to encourage people, find one trusted person at least. Find someone
Yes,
that
that
you
is.
believe can be support to you and walk this journey with you.
Mhm,
There are resources out there. There are community organizations that help with those who've experienced maltreatment and violence. And maybe there are free groups that you can participate in, but there are spaces. But I
mhm,
think it is also a part of that courage, that strength, which is
mm.
there is strength in numbers. And if
There
you are
is.
struggling or have struggled alone, find at
Mhm,
least one person that you feel
yes.
like is trusted in
Mhm.
your life.
Yes, unsafe person, trusted
Mhm.
person could be healing and instrumental in various ways. I am not trying to make a plug, but what you just stated inspired me related to my passion project, my project where I feel my flame will never burn out towards it. But it does come from all the clinical experiences I've had where I've worked on the low end of the socioeconomic bracket and the high end. And no matter what category you fall in, fortunately, all persons can be exposed or
Mhm.
experience these different forms of violence. And my nonprofit is rooted in that, basically wanting to give voice, speaking up through increasing awareness, working towards prevention efforts, and looking at this on more than one level. So, a great part of it is fundraising to specifically offer psychotherapy scholarship vouchers. And I do think that's key for persons that are on the low end of the socioeconomic spectrum, but that there are
Mhm.
persons that have insurance as well that can't afford their copays.
Absolutely.
So it's keeping all those that have been impacted in mind and wanting to be a resource to support those that are seeking quality trauma informed services. In addition to that, the biggest part of my nonprofit is focused on that. But the other part is looking at that parallel process that practitioners go through who are licensed mental health providers committing themselves to supporting the healing of those individuals that have experienced specifically sexual violence. So it's normalizing that practitioners are not many gods. They're human beings and they themselves need support, as we discussed earlier, because of the potential of vicarious traumatization, secondary trauma, and burnout. So I want to be able to create a safe space for these practitioners through retreats and different events in the future to
Mhm.
pour into them so that in their commitment, they have a sense of renewal, a sense of being able to take care of themselves and be in community with other persons doing the same work as they remain committed to this critical issue.
It's so needed. And I appreciate the two-prong approach, right? Um,
Mm,
it is really important that we try to bridge the gap for those who have economic challenges that prevent them
mm,
from getting, as you
yes.
said, quality mental health care. Because unfortunately, there is a stark difference between someone who has a caseload of 400 and, not
Yes.
able to really manage all of the
Right.
nuances of your story versus
Mm-hmm.
someone else who perhaps has more time and attention that they can dedicate to what your story is. And so I
Yes.
appreciate you trying to bridge
Mm-hmm.
that gap so that people can get
Mm-hmm.
to that service. And likewise,
Mm-hmm.
making sure that you're taking care of the caregivers, those who sit in this space and hear and hold safe containers every day for people.
Mm-hmm.
They often need refreshing. They need replenishment.
Absolutely.
They need
Yeah.
pouring back into. And so that's
Yes.
equally as important so they can continue to do the work of being safe spaces for others.
Mm-hmm.
I want to ask you, how can people contribute? How can people support the work that you're doing? Give them some information.
Well, I'm open to sharing information. And I will say this again before I share the information. This came out of my clinical experience, research, working in so many different settings, but it was on the back burner for some time because of
Mm,
what you just mentioned, working in various systems on a federal, state level, and outpatient clinic level. You're right, the caseloads are extremely high. And I'm
mhm.
someone that's always been mindful of self care, meaning I'm going to offer quality service while I'm here, but outside of that, I have to go enjoy the outdoors. I need to be
As the
able to
kids
take
say, you need to go
five,
touch grass.
go on a nice hike. I love visual and performing arts. I love being creative, just super intentional around that. But it didn't provide time to be creative in the ways that I thought I would love to be professionally, and while also being a source of support. So I would say January of last year through Candler, I started, here we go, exploring into other areas of Emory, and I came across the incubator program. And didn't know much about it, but I did know that they supported startup ideas for businesses. It was like my launch, in a sense, speaking to the director, like, hey, I would like to meet with you. I've had this idea for years. I don't come from a business background, mental health, and now I'm in the school of theology. And he was like, yeah, sure, let's talk. And I shared with him my idea. And I remember initially he was just sitting there quiet. And I was like, I don't know if this is interesting him or not. But at the end, to my surprise, he was able to repeat everything and add information. He was so connected and spoke to this is needed. And I just felt so like heartwarmed. Like, okay, it's not just a passion of mine. Someone else could see that there truly is a need. So, I had a soft launch last April because in our discussion, he was like, you should be able to at least start sharing your idea, plant some seeds, have some conversations with people. And I thought it was such an achievement just to have a soft launch last April. And April was key because April nationally ends up being Child Abuse Prevention Month and also Sexual Assault Awareness Month. So
Mm,
it gave space at this soft launch to speak to those issues, speak to my ideas. And I even put together a survey like, what are your thoughts related to this? What do you think is needed? And I also have a survey that I haven't launched yet that's going to be for providers. But
okay.
things have moved forward. I had some significant help and encouragement this past fall through the incubator program, and I have continued to build. So this month of April, I feel I've stepped deeper into it with now officially being a 501c3 and ramping up just support specifically to scholarship vouchers for psychotherapy. And so I do have a website, an ongoing campaign to support that. Money specifically is being raised for that because that's the number one program or pillar in the organization at this time. And as wind starts to pick up and hopefully sponsors, I'll be able to move to include the work for practitioners. So as you noted earlier, my nonprofit is called Ignite Transformation Institute. for the wellness of women. The website includes, I would say, all information. That
Okay.
website is ignitetransformation.org. There you'll find the mission, our purpose. You'll find the donation link. There is also a listing of contact information, whether it's through email, all social media handles are there. And with us approaching the end of April and this Wednesday being the last day of April, I will be having a virtual gathering. And I've specifically noted that this isn't a gathering to process trauma, sexual violence experiences, intimate partner violence experiences, but it's an act of universality, gathering to reflect, to feel empowered, I think being in community is a big thing.
It
And
is.
so it's survivors, it's loved ones of survivors and practitioners that will be participating in this event. So I'm thankful to be able to offer that. Beyond April, the work continues. It has to continue. So fundraising efforts will continue after that, as well as other programs.
Right. And
Mhm.
as we are in the month of May now, we are looking at Mental Health Awareness Month. This is a month where there'll be lots of different programs and resources and information available to people through various
Mhm.
platforms. We encourage
Right.
everyone to be very intentional about their mental health,
Mhm.
particularly this
Mhm.
month, since we have a highlight and a focus on it. Lastly, let them know how they can find out information about your practice and how they can get you and how they can book you and all those things.
Oh, that is a great question. So, the name of my private practice is Insightful Wellness and Empowerment Services. I am thankful for the opportunity to provide psychotherapy services in private practice because, again, my heart is with that type of service. I don't want to say I've had to, after my first semester in seminary, I had to make a tough decision to put my private practice to the side. Because when I first started, I was like, oh, wow, I'm not working full time. I don't have this enormous caseload. I had been in graduate school before and I knew it would be different, but I was like, I can manage graduate school plus my private practice. And I had to realize, you know what? No, I can't. Based on my values of practicing and wanting to be available for my clients, this is something that can't be sustained at this time as I walk through the journey of seminary. And now I'm walking through the journey of becoming credentialed as a chaplain. So
Congrats.
thank you. It is such a big deal. And there's another story with that. But I will say I just completed the first step, which was clinical pastoral education and the internship last fall. Right now, I've been in the process of interviewing for the residency, which lasts
Mhm.
a year.
Oh, yeah.
And that gets me
Done one.
closer. One more time.
Done one. Oh, yes.
Oh, yes. It's been a journey, but very helpful to see that practicing as a licensed mental health provider is very different than entering a setting offering spiritual care. So it's been good
Mhm.
to see how, again, we could do this by vocational work. So I would say after I finish my residency, get more solid in where I'll be practicing as a
Mhm.
chaplain, I will look forward to reopening my private practice. But the website will still remain the same. That website is insightful.
Awesome. And they still should be able to find your contact information through your website, right?
Yes. So my contact information is there, and as well as my nonprofit website.
Awesome. Well, this has just been a great conversation to have. I think there's so many things that were kind of lifted up, not only about intimate partner violence and, I'm sorry, interpersonal violence, but information about how to start that healing journey. And some
Yes.
factors about trust and building
Mhm.
community and having the courage and the voice to share your story. All of those
Yes.
things are important. All of those things are needed. And to know
Mm.
that you are not alone in this journey, no matter what has
Not
happened, no
alone.
matter what someone has said to you, you are not
Right.
alone in this journey. It is not a
Hmm.
singular issue. There are others who have walked through, survived, and have come back into their own sense of power. So know
Right.
that that is on the other side of your healing journey.
And it's never too late to speak up. It's never too late.
Absolutely. And so we encourage all of you who are listening, if this is a part of your story, a part of your history, that you connect with a professional who's trained to help you walk through that journey so that you can continue your healing. Thank you
Yes.
so much for participating in today's podcast. I appreciate you, Dr. Jones.
I
Thank you
appreciate
for
you,
being
Dr.
here.
Glenn.
Please like, subscribe, share, and follow us for all future episodes. Thank you so much for being here today. You guys take care, and we'll see you on the next episode. Take care of yourself and be well.
Theo Therapist Podcast, real talk at the intersection of theology and therapy. Check out Dr. Glenn's new journal series titled Brain Dump Journals for the Busy, available on Amazon. Visit our websites for more information at thetheotherapist.com or CatriceGlenn.com.